Welcome to this edition of Security and Compliance Weekly. Today we're talking to Jordan Wiseman. He's a principal consultant at Online Business Systems, the place where I work, which makes him a friend, a colleague of yours truly. Jordan is going to help us do a deep dive into HIPAA today because it occurred to me after 78 episodes of Security and Compliance Weekly, we haven't talked about HIPAA yet, so I thought it was long overdue. And Jordan graciously accepted the challenge to come in and facilitate a discussion. As is my desire in all things, we're going to start with a little bit of a quick HIPAA primer, just to make sure we're all on the same page. And then we're going to talk about some of the challenges that companies, organizations face trying to meet their HIPAA requirements, what they might be, talk about current events, whatever comes up, because all of us are chomping at the bit to talk HIPAA. So if you're ready, put on your paper gown, put all your valuables in the locker, get ready to draw blood, and have your vaccine cards ready, and join us as we continue our journey of tearing down silos and building bridges on Security and Compliance Weekly.
This is Security Weekly, for security professionals, by security professionals. And now, it's the show that bridges the requirements of regulations, compliance, and privacy with those of security. Your trusted source for complying with various mandates, building effective programs, and current compliance news. It's time for Security and Compliance Weekly.
And welcome to episode number 79 of Security and Compliance Weekly, recorded on July 13th, 2021. I am your host, Mr. Jeff Mann. As you can see, I am in studio, which is so exciting. I'm here for the week, so I'll be here for Paul's Security Weekly later on Thursday. So excited to be here and seeing, my family, Security Weekly family that I haven't seen in 16, 18 months for some healthcare related reason. Joining me today are my co-hosts, Mr. Scott Lyons, Mr. Josh Marpet, and Mr. Frederick Lee. Gentlemen, welcome. Wish y'all were here.
So do we.
Someday. Hey, don't forget, security.
We were there before. We'll be there again at some point.
You'll get back here, and hopefully you'll feel better next time, Scott.
I know, right?
Hey, don't forget, Security Weekly Unlocked is coming up in person this December 5th through 8th at the Hilton Lake Buena Vista. Our call for presentations deadline has been extended through July 23rd at 11:59 p.m. Eastern Time. You can visit securityweekly.com/unlocked to submit your presentation. We want you to come talk at Unlocked. Also coming up, here we go again. July 14th. What is that stupid thing called? We've got a name for it. No. What do we call it? Democast. That Democast. Sorry, I had to back up, which we can't do apparently. Democast is coming up July 14th, and it is going to be how to protect your entire attack service. July 15th, that's at 11 a.m. Eastern Time. July 15th at 11 a.m. Eastern Time, we're going to have a thoughtful approach to SASE and how that can improve security and enable scalability. And maybe we'll even find out what SASE stands for. Finally, July 22nd, our technical training, also at 11 a.m. Eastern Time, we'll be learning how guided SaaS NDR enables rapid response. You can sign up for all of these webcasts by going to securityweekly.com/webcasts. And also, of course, if you have a desire to see any of our previously recorded webinars or technical trainings, they are available at securityweekly.com/on-demand. All right, on to the show. It is my extreme pleasure to introduce you to one of my favorite colleagues at Online Business Systems. And I say that probably because he mostly agrees with me on things that we see are wonky and wrong. We were just doing it in the last hour. We had a client trying to pull a fast one, and we're like, where's this coming from? Anyway, I want to welcome Jordan Wiseman to the show. Jordan, welcome.
Hey, thanks, Jeff. Thanks for having me, everybody. Nice to be here and see everybody. And I'm particularly excited to be diving into some healthcare information security and privacy topics today.
Well, we always like to start out with learning a little bit about our guests, Jordan. So tell us a little bit about yourself, your background, how you got into security. And I'm particularly interested, especially for our audience, for you to share how you decided to make the jump over to more the consulting advisory side of the world rather than the in the trenches tech type person. So please tell us a little bit about yourself.
Sure. Yeah, I've been dealing with tech and security since the late '90s. I started doing that mostly because I think the joke of what I've told people before is that I kind of discovered unprotected systems meant that I had free resources to play with, and that's kind of how I got going on things. Not so much hacking, so much as really just kind of squatting in other people's places, other people's technology systems. I started professionally actually in the healthcare space, which is why HIPAA is something that's near and dear to my heart that we'll talk about a little bit later. And I was on the engineering side, so dealing with security and privacy, big iron Unix systems, underlying, healthcare environments, that kind of stuff for quite a while. I jumped over to the consulting side, mostly because I got tired of not being listened to quite as much. When the advantages of being a consultant when you go to places to make meaningful change or to help people, improve security is you come with that assumption of expertise in security. And so sometimes it can be an easier, more effective way of making a meaningful difference in the lives of data, I guess, in this particular case.
Some might call it expertise. Some might call it the raw power of, oh crap, it's the auditor, because they always call us auditors, and they know that they have to do something. So
yeah, well, it's also that idea that they're paying you for your expertise. The fact that they're giving you the money for it in the first place comes with some implied trust that makes greases certain wheels that would be more difficult to get rolling otherwise.
Great.
Well, I mean, that implied trust comes from the top, not necessarily from the people doing it. So, the practitioners.
True.
So you've got the implied trust in the people who are like, here, have multiple thousands of dollars to check out what we're doing. And the people actually doing it are like, I'm fine, leave me alone.
Well, and sometimes that's a double-edged sword that works the other way. Years ago, I was working on setting up a virtualization infrastructure for another hospital system that I was at, and they wanted to bring in one of those trusted third parties, those consultants like I am now, to provide that third-party validation that I was doing the right thing. And the guy who showed up to do the work was the guy I had helped in class.
Funny.
We had a good time.
Well, we also like to start our shows with asking our guests what we call the hot seat question. And that is simply because this is a show about security and compliance, and especially since you've sort of worked both sides. What is your take on this thing that we call the security versus compliance continuum? Where do you fall?
I think that if done correctly, and security is implemented not just according to best practice, but according to what makes sense, compliance should be no more complicated than demonstrating you're doing the right things. Now, I realize that for a lot of compliance schemes that there's a lot more T's to cross and I's to dots in terms of specific details that have to be handled and specific things that have to be demonstrated for that particular compliance scheme. But I don't really like the idea that it's an adversarial kind of security versus compliance thing in the most part. I think, one of your old favorites, Jeff, is a perfect example, PCI. PCI is a collection of, you guys have talked about this a whole bunch, practical, reasonable security controls that could be applicable to almost any environment. And if done correctly, compliance should almost be automatic, except for the evidence. And that's kind of my perception on it. There's no reason that you can't do both. There's no reason that doing security correctly gets in the way of compliance, or more importantly, the compliance needs to get in the way of security. And I think that's where a lot of organizations fall down, is they focus too much on needing to get that piece of paper that says they meet a certain standard. They focus too much on what evidence needs to be collected. And unfortunately, sometimes that takes them away from the actual more important practical side of ensuring that data is actually secure in the first place.
Interesting.
So I'm not sure if I answered that question or not, but that's kind of my rambling opinion on it.
Well, I mean, it's an opinion question. There are no right or wrong answers. We're just trying to get to know you a little bit and just get a little bit inside your head and, understand where you're coming from. I find that helpful in terms of having a conversation with anyone, is just to, try to get to know a little bit where they're coming from. I may agree or disagree with them, but at least I know where they're coming from. So let's...
I was just going to say that brings an interesting point. If we take that a step further, I said one of the other things that I've spent a long time kind of focusing on in my career is this idea that security and usability also are often kind of seen as conflicting ideals, and they don't necessarily have to be. I've always been a fan of engineering systems in a way that makes it easy for the people that actually need to use them. I mean, too many IT people forget the fact that IT is a service organization within a company, third party, whatever it is. Other people need to use their computers to do a job. Implementing security correctly, especially in terms of things like adequate access controls and least access and stuff, means they can do what they need to do, and you shouldn't be needing to get in their way in terms of doing that thing. And there's interesting strategies for that, and we can have a whole separate discussion about UX design and workflow design and all that kind of stuff. But to me, that's also really kind of important aspect, because if you get those things right, it's much easier to get the buy-in you need to do security and monitoring correctly, and it makes it much easier than to get those pieces of paper to validate you meet the standards that you need.
Yeah, I certainly agree with that. I can remember one of probably the worst client I ever had from a perspective of this was a director of security. I don't think that, CISO wasn't in vogue. This is going back probably 20 some years. But it was a healthcare organization, and this guy's attitude was, I am Lord and God. What I say goes. I don't care what anybody thinks. We are going to do this. We're going to do it my way or the highway. And you can imagine he was not a very popular person, and he had very little success in implementing the right kind of security program. But
that was how many years? You said that was 20 years ago.
Yeah.
So 20 years ago. It was, we have our silos, we have our fiefdoms, we have our ways of doing things. And I would argue and posit that CISOs in the last 10 years, 5 years especially, have had to learn corporate politics, have had to learn how to negotiate, have had to learn how to get along. You can't just merely dictate, and that's the way it will be anymore, because it doesn't work that way.
No, the silos are still in place. Why is the tagline of our show tearing down silos and building bridges?
Well, no,
right?
The silos,
if those silos were gone, if we have actually learned from our mistakes, then we as security professionals would not have to constantly beat the drum of do the basics, check your passwords, train your users. We wouldn't have to do this, but guess what? We still do. So I'm actually going to go against what you're saying.
Well,
I think you're both right. I think the silos are still there, but I think the way that you tear down silos is you do all the, I hate to call it the touchy-feely things, but if you help people understand the context and the reason why they need to do something, and if it's not going to impact their work, and it, in some cases, it might even make their job easier. It might eliminate some steps if when things can be automated and things like that. So I think you're both right. But let's move on to HIPAA.
It soft skills, not touchy feely. But actually,
I like touchy feely. Is that inappropriate?
No,
depends on how touchy.
Or for HIPAA, we should say I like to palpate. Isn't that the medical term? I want to.
Well, it's actually very apropos because of the way that we deal with people and the way that we talk about dealing with people, especially trying to translate tech to business. A lot of people are touchy-feely with these subjects, and we have to, as IT people, take that guarded risk, if you will, of somebody that we're explaining this stuff to might not understand what we're talking about. So how can we play with kid gloves? How can we, play touchy-feely, with being very careful about where we step and ensure that we're getting the point across?
Well, I think part of that is definitely realizing that some people may not understand the deep esoteric technical things that we're talking about, and some of that for us, especially from the engineering side, is being able to take that humility to recognize that we need to improve those skills. I worked as an engineer for all those years, and when I went back to school to finish my degree and do all that kind of stuff, I went to business school, not to tech school, because I recognized that I picked up a lot of skills on the fly and I could deal with all these complex topics, but I needed to learn the business side of things, those so-called soft skills that we're talking about now, not just to help break down silos, but to make me more effective. If I wanted more money to spend on the things that I wanted as an engineer or as a security professional to do things correctly, I had to be able to make those cases to business people who didn't understand the tech, but they understood the business.
Right. So let's put that in the context of HIPAA, and I really want to start off with, I don't like to assume that anybody knows what any terminology is that we're using in this industry, because very often I find out that people don't actually know what things are. So tell us a little bit about HIPAA from a high level. What is it? What is it all about? What are the goals? And you know, especially how it applies to security. You know, what is it about security within HIPAA that makes us all have to do HIPAA, or so many of us have to do HIPAA?
Sure. Well, let's kind of start at the beginning. So HIPAA is the Health Insurance Portability and Accountability Act. Now, you notice none of those A's and none of those P's were related to privacy or security and that kind of stuff, although accountability kind of matters.
Jordan, I'm sorry, it's actually health information.
No, it's health insurance. If you go look on HHS website and you actually read the act itself, it's Health Insurance Portability and Accountability Act.
If I'm wrong, I apologize.
Well, I thought for years that it was insurance.
Health insurance.
Our health information also, and our. I was recently reminded that that's not the case.
Right.
The original point of HIPAA, which that gets right back to, was actually about easing access to healthcare by making it easier for healthcare providers and organizations to share information so that they could actually bill. I mean, the
Bill
health
properly,
insurance system here, the health insurance system here has been and is still. There's a lot of room for improvement. Things have been a lot better, but HIPAA kind of started off as a way of standardizing. Well, it's an entirely different discussion we can get into later. But
we will
take a drink and we'll get there
on the second. Yeah, we will get there. Oh yes, we will. It will happen.
So the idea was standardizing how organizations would share that information and prepare for doing it electronically. I mean, that was kind of the idea. And when they created that rule to make things easier, or to created that law to make things easier, they recognized that, well, encouraging folks to do electronically is going to expose health information to the same kind of problems. I mean, this was back in the late 90s when they were talking about all this stuff during the birth of the .com era and all that kind of stuff. And they were seeing, credit cards were being stolen and skimmed and that kind of stuff, because, that doesn't happen anymore. But politicians and people were afraid enough to recognize that they needed to add requirements in here, not just to protect health information, but to ensure that it was used appropriately. And that's kind of really what the where HIPAA came from, is standardizing, encouraging use of electronic systems and standardizing the exchange of that information, mostly for insurance and billing purposes, with an eye towards doing it securely. And this kind of steps into an area that a lot of people outside of healthcare especially have misconceptions about what HIPAA protects and what it does and who it applies to. So HIPAA says that healthcare providers, healthcare plans, so your insurance company, and then clearinghouses, so organizations that enable those two to talk to each other, like the middleman from a data interchange kind of capacity. The people who create or receive health information is who HIPAA applies to. So it doesn't apply to your employer necessarily. I mean, there's like everything, there's a lot of it depends there. It doesn't apply to your friends or colleagues or kind of other folks, but it specifically is about those people who you normally expect to handle and deal with your health information. And it implies rules or enforces rules on them that they have to do to protect that information, to keep it secure from a risk-based perspective. In fact, HIPAA is one of the few standards that says you not only have to assess the risk to the data that's covered, but you actually have to do something about those assessments, which implies checking it again. In fact, HIPAA has a specific rule that says not just do the risk assessment once and apply some risk treatments. It says you have to periodically make sure that they're still effective and that they still apply and that you don't need to do more stuff. On top of that, it also has, as everybody is kind of aware of, and most people assume HIPAA has to do with privacy, it actually imposes a set of rules on those organizations in terms of what they can and can't use your health data for, with or without your permission. And most of those rules are designed to allow those organizations to share it to better treat you. If you go see your doctor and you've got something that they've never seen before and they need to bring in another doctor, HIPAA says they can do that. They don't need necessarily to go and get your permission again to bring in another doctor to discuss your case. They can't discuss it with other people who call and just ask and want to know about your position, that kind of stuff. That's not allowed. It also has provisions in there related to public health. So this is kind of on everybody's mind related to the COVID pandemic we've just went through. HIPAA allows hospitals and your doctors to share information with public health authorities so they can do things like track incidents of infectious disease that is making life problematic for lots and lots of people. I mean, those are just a couple examples. But
you are so diplomatic. You are so effing diplomatic.
It's habits and things I got from the business school,
A little, a little infectious disease issue that some people are having problems with. Worldwide pandemic, man. No, seriously,
fair enough.
Well done.
And that's something that probably should be stressed a bit more. That it's not just a little problem some people deal with. This is a big freaking deal that folks need to take a little more seriously. But I'll get off that particular soapbox.
So when I first went to work for Tenable, 8 years ago now. Yeah, I came in being hired as the PCI expert, but I was immediately branded as a compliance expert, and very
That's
early
what
on,
PCI means, right?
they wanted me to do something with HIPAA. I'm like, I don't do HIPAA. I've never done HIPAA. So I started looking into HIPAA. I said, well, how hard can it be? And I like to start at the beginning and start with basic definitions. And I was very immediately frustrated and kind of perplexed that I couldn't find an actual definition of the type of data that HIPAA seemed to care about, which was personal. What does PHI stand for? Personal healthcare information?
Protected health information.
Protected health information. I couldn't find just a short, succinct in the HIPAA documents, the charter, whatever it's called. I couldn't find a definition of PHI. I found lots of examples. I found better supporting documentation that came closer to a definition. Sure. So let me ask the stumper question: what is PHI?
All right, so we'll go down the rabbit hole.
You'll know it when you see it.
Pretty much.
So laws like source code involve a lot of references to other places and variables. So you have to look in a couple different places to pull all the details together. But protected health information essentially is three things. It is personally identifiable information about an individual related to their current, past, or future, like expected health condition, the provision of health care to that individual, and the payment for that health care. And that's kind of really it. There's a couple of loaded terms in there. There's a couple of loaded terms in there, like identifiable information. So is all PII PHI? No, but all PHI is by definition PII. Does that make it clearer, muddier?
Clear.
Is that like saying not all systems are compliant but secure, and they're secure but not? Wait.
Yeah.
We'll come back to you, Scott.
Can you unmuddle all of that?
Sure. So at a more basic level, it's information about a person's health and their health conditions. So whether you've got a cold, whether you've broken your arm, whether you're sick with a chronic condition or something, any of those things, that can uniquely identify you as a person. So health records are one of those things that it's hard for people to change over time without doing things like severely hurting themselves, injuring themselves, or getting further sick. But anything related to that stuff that can uniquely identify the individual. So PII related to health condition and health kind of stuff is essentially PHI, as well as information related to the payment for that data. So financial records that you use to pay for healthcare stuff, and mostly that's because one, HIPAA applies to insurance data, but two, that's an easy way. Follow the money is the way you tie activity to somebody, and that kind of gets to identifying individuals here too.
Does that include? And sorry for going a little bit down a rabbit hole. In terms of payment, does that include not only the co-pays and what the patient is paying, but also what their healthcare provider, their insurance company is paying? It
can, yes.
All right, interesting.
Like everything, it depends, of course, but yeah, if it can uniquely identify the individual, if you can tell that I was seen by my neurologist based on the amounts that I paid to which specific organizations, that's uniquely identifying health information protected by HIPAA.
I guess.
And Jordan.
Oh, go ahead, please.
Does all of this information have to be combined with treatment and payment, or is it just sufficient? Would a definition of PHI literally just be a person's name and whatever their medical condition is? So, for example, if I'm diabetic, just knowing like, hey, Flea, somewhere in some of the records, like, hey, Flea is diabetic. Is that in itself just PHI, or does it have to be associated with Flea is diabetic and here's his insulin prescription and here's how he paid for it?
So the fact that Flea is diabetic could be PHI if it's associated with one of those organizations we talked about before. So a healthcare provider, a health insurance company, or one of the health clearinghouses. if that information is not already public. That's one of the exceptions out there. If that information is already public, if you've gone out there and tweeted about your diabetes or your care or whatever, then that information itself may not be protected because it's already public. So it's not necessarily that it's associated with specific details of your treatment, but it has to do with who owns and controls that information, what they're doing with it. So if you posted that online, for example, that's not necessarily PHI, even if you would consider it sensitive. If you're a family member of yours, if your boss knew that at work and they posted that somewhere online, that wouldn't necessarily be a HIPAA violation because they may not be a covered entity. Right. But if your doctor started talking to other people about it or posting it online, or maybe even if you had developed a diet regimen that was really, really good for your type of diabetes and your doctor wanted to tell the world about it and started giving talks about it on stage, identifying you specifically, that could be a HIPAA violation if you didn't give them your permission to do that.
You used a term, Jordan, that I would love to actually extrapolate on, which is this idea of a covered entity. I know one of the things that a lot of companies wrestle with is whether or not they have HIPAA requirements. Like, are they an entity that should be concerned around this? A great example is kind of like some of those entities that are, for lack of a better word, almost like common carrier. I think about one of my previous companies, Twilio, which obviously did a bunch of telephony. You think about a company like Twitter, and kind of as you mentioned, like, hey, posting stuff on social media. And I'm kind of curious, like, where that line is drawn between who should be a covered entity and who shouldn't be.
Sure. So I talked about those three types of organizations before that are the ones HIPAA specifically applies to, right? So health insurance organizations, healthcare providers, and the healthcare clearinghouses, those middlemen that sit between them. A covered entity is any one of those three that creates or receives protected health information from another. Organizations so there's also kind of gets in the murky area of what are business associates, which we'll talk on a little bit, but that's essentially what a covered entity is. It's one of those three type of organizations that creates or receives health information from one of the others, which as you can imagine leaves out a lot of other potential organizations. There's also the concept of a business associate under HIPAA, which is a third-party organization who provides related services to one of those covered entities, and who receives protected health information from them to do something with that data on their behalf. So it's not necessarily any organization that receives PHI, which is kind of one of those interesting details that matter a lot. A lot of health organizations assume that anybody that receives PHI from them is a business associate, but that's not necessarily true. For example, if they work with a third party, contracting organization to do their, say, medical billing, for example, if that billing provider is actually working as a member of their staff in their office and that kind of stuff, they're a contractor, but not necessarily a business associate, unless they were to send that data to the third party and it to be handled off that way. And there's some technical details there, but everybody has, they already have to ensure those people meet the same rules, which is getting into a different topic. But does that kind of answer the question?
Oh, yeah, that definitely answers the question. And I'm glad you already jumped into business associates. Because I'm also kind of curious, and I think it's one of the areas that people get confused about. Like, what are the requirements on business associates? We think a lot about this idea of people signing these BAAs, and would love you to actually define BAAs for the audience. But I'm also just kind of curious, like, how does somebody even recognize that they're in that space?
All right. Well, I'll have to give the standard disclaimer. I'm not a lawyer, but let's talk about. So a business associate, like I said, is a third party who receives protected health information from a covered entity. So one of those three types of organizations who created or received the PHI in the first place, to do something for the benefit of that organization. So it could be billing, it could be monitoring, it could be a lot of times organizations get involved with things like quality metrics, monitoring and reporting or that kind of stuff. A business associate agreement is something required by HIPAA that a covered entity is supposed to have a business associate, one of those third-party organizations that's working for their benefit, to sign that essentially says they have to abide by all of the same rules in HIPAA in terms of the securing the protected health information they've got, using it for the acceptable uses as defined by the privacy rule and all of that. Interestingly, the HITECH Act that passed in 2013 amended HIPAA to say essentially that business associates have to comply with all the rules regardless of whether a BAA is in place or not, What the BA serves to now, in addition to getting agreement that those organizations will follow all the rules, is also to identify who owns the data and who's responsible for it. Like a lot of privacy regs that we're dealing with these days, because it's being more popular out there with GDPR, and people talk about controller and processor relationships, or under CCPA where you've got third-party relationships from the owners and that kind of stuff. Under HIPAA, the covered entity still is the one responsible for the data. And if the business associate has a problem with security, if they get breached or whatever, they have to notify the covered entity immediately, but it's still the covered entity's responsibility for that data for the most part.
All right, time out. Define business associate.
A business associate is a third-party organization who receives protected health information from a covered entity to do something with it for that covered entity's benefit.
Okay.
So yeah, and the business associate agreement is sort of what contractually kind of enforces that relationship and those controls, and it's kind of an extra control now because HITECH says that HIPAA applies to business associates anyway. Third parties who aren't necessarily business associates but are still dealing with or working with a covered entity or with a business associate, and you have to rely on more traditional data security agreements for those folks to make sure that if they happen to see PHI, if they're dealing with the systems for like, let's say they're not receiving PHI for helping the organization, but maybe they're providing support services. You've outsourced your help desk to a third party, and they may inadvertently, or they may, in the course of doing their business, come into contact with protected health information in your environment. Well, they're not necessarily a business associate, but by contract, you have to enforce rules that they will take the adequate steps to protect the information that wouldn't necessarily otherwise be covered because they're not a business associate. So HIPAA wouldn't necessarily apply to them without that other contract.
So if somebody's not following the rules, what's happening to them?
That's a great question.
I guess more generically, the question I wanted to ask is who's the enforcer in all this, and what are the consequences?
Sure.
So the enforcer.
HIPAA is a U.S. Federal regulation, and it's enforced by the Office of Civil Rights. So HIPAA carries with it not just the requirements of these rules, but it actually comes with civil and monetary penalties. It doesn't create a private right of action. In other words, you couldn't sue necessarily your hospital directly for a HIPAA violation. There's a lot of ifs there, of course, because there's overlap with state laws and a bunch of other stuff. But the federal government can enforce civil penalties, so they can fine organizations who aren't HIPAA compliant, and they can enforce criminal penalties if those organizations are I suppose it's more for egregious kind of things. But if an organization knowingly or willingly doesn't protect health information, or worse, does something with it they know they're not supposed to, people can be thrown in jail for it and have been thrown in jail for it.
Wow, that's different.
We have HIPAA here in the U.S. We've had HITRUST come in and HITECH try and come in to enforce it, and we have HITRUST, which has even heavier penalties and fines if you're not following it. What do we have in Europe? Like, what's the equivalent over in Europe for this? Is it GDPR?
Yeah, so GDPR is probably the most direct analog. In fact, a lot of how GDPR was structured, in fact, how a lot of the privacy regs are structured, borrowed a lot from HIPAA's approach to this kind of stuff. Other than GDPR over there, as far as I'm aware of, there may be different rules in each country. And in fact, that's something here that we have in the States too, where the federal government has HIPAA and it's got those civil and criminal penalties associated with it. But individual states can actually enact laws that are more strict and more stringent than HIPAA. And that's true for countries in Europe and elsewhere in the world as well. It's worth noting, in fact, that a lot of the extra protections here in the States, things you would consider special category data in GDPR over there, related to highly sensitive conditions. So maybe, someone's HIV status, or someone's dealing with substance abuse problems and that kind of stuff. Most states here, so there are some additional federal rules for that, but most states here more strictly protect that information than even HIPAA goes, to the point where it may not be possible for a healthcare organization even to admit that patient is receiving that kind of care.
Right. And the big differences between HIPAA and GDPR come in the form of consent and the right to be forgotten. Consent, GDPR explicitly makes it mandatory versus HIPAA, which says that the disclosure of some for the treatment purpose, and then the right to be forgotten under GDPR, individuals can be forgotten, or they can have a request to delete their data, versus HIPAA, which doesn't grant this right. So
Right.
Do we see businesses that fall under HIPAA retaining that for the life of the patient, the life of the data, data destruction rules? Where does that fall into place? Because knowing where our data sits and who uses it and how it gets folded, spun, manipulated is really a big issue that all industries are facing when it comes to information security. Like, that's one of those hot button topics. How does the data get handled in something like that?
That is a fantastic question. And the simple truth is it's a difficult question to answer, and it's kind of a mess. So let me give you an example. So when I was working in the healthcare space on the other side of the table from consultants, for example, I was working for a public hospital district. And in the state of Washington, which is where I live, there is a state-provided schedule of data retention requirements for public hospital districts. It's 138 pages. Because not all of the data involved, even if it involves your health information, is necessarily your data or about you. For example, healthcare hospitals that do implant medical devices in individuals have requirements from the FDA and the other agencies that deal with those kind of implantable stuff to keep records of those implants, every single device and every single serial number for that device that went into every patient. And they need to track it for safety reasons in case there's ever recall or whatever else. You wouldn't necessarily want or be able to ask the hospital to get rid of that information, and they have to keep it for, I think that particular information they have to keep for the life of the patient itself. That's also true for all sorts of different medical stuff, because all the data that's there that's about your treatment for care isn't just about your health. It's about the performance of the healthcare providers that are dealing with you. It's about the safety of the tools and techniques and devices that they're using with you to do that. It's about the practice within that organization. So getting back to that question for you, yeah, it's you have the right under HIPAA to request a copy of all the health data, your medical record, those kind of details from you, or from the healthcare providers. But the records themselves, their documentation for how they're treating you and dealing with that kind of stuff, actually isn't your medical record. It's their business records.
Right. And you were talking about medical devices. Are you saying stuff like Pfizer, Moderna? Wait a minute, that's not a medical device.
Things like pacemakers and stents and that kind of.
So being 5G compliant is not high on the list.
Well, there's a whole lot of safety stuff related to that kind of stuff, to be honest, because things like pacemakers, you don't want a pacemaker to deal with getting interference from high power transmission devices. Not that 5G is any kind of danger to those kinds of stuff, but you do want.
Tell the truth, man. Tell the truth.
5G is safe. That's the truth. If you want people to let's say you get a pacemaker and they discover 30 years late down the road that, oh, hey, when somebody has this model cell phone or maybe they've got this other kind of implanted device that they may actually interfere with that pacemaker, and they don't discover that for 30 years, you still probably want to know about it and take whatever steps needed to keep your pacemaker working, right? So that's one of the reasons I keep all that kind of data.
Hey, let me jump in real quick. We need to take a break. We'll come back and we will re-engage with this fascinating discussion. Be right back.